Hello, I'm Dr. Floyd Atkins, and I wanted to take a little bit of your time to talk to you about something that's very important, and I call it detoxification and cleansing. Detoxifying and cleansing your body is a key to optimal health. It's something that we should do on a regular basis. Taking care of your body requires that you at least clean it at least once or twice a year and pull the toxins out that we accumulate every day of our lives. We pick up so many toxins from artificial colors and artificial flavors and the dyes and the chemicals and the preservatives, mainly in the food we eat, but also in the air we breathe. You have to consider that in the water we drink, we pick up a lot of toxins. These toxins, over a period of time, accumulate in your body and bring about a condition what we call a toxic overload, or create a toxic burden on your immunity and your overall functioning of your body. So it's important that we establish a guideline or protocol for our own bodies of how we detoxify ourselves. A lot of the lectures I give, I emphasize to people that the most important decision they make every day in their life is what they pick up with their hands and what they put to their mouth. That decision is more important than the jobs we have. It's more important than the finances we make every day. It's more important than anything else because it determines how we feel. It will determine how we look. It will determine the amount of energy we have. It will determine the longevity of our life. It determines the quality of our life and also the quantity of our life. So we want to be very clear on how we treat our bodies and what we put in our bodies as well as what we put on our bodies. Now, several years ago, after years of research, looking into ways that we can cleanse our bodies and also detoxify our body, I have developed a program called the Dr. Floyd Atkins 40-Day Detoxification Program. And this program is ideal for people who want to change their lifestyle. It's not just a diet, it's not just a nutrition program, but it's a program designed to help you recreate your body. You want to make your body all new again. And that's through changing the food we put into our body and how we treat our body when it comes to lifestyle and when it comes to our everyday lives. So I want to share with you the steps that's involved in this program, and hopefully if you're interested in it, you can give us a call at our Center for Wellness and Healing. It is a medically supervised program that we do, and we would like to help you go through it. Now, before I get started, I want to tell you some of the benefits of the program. It's always very important to know what you're going to get out of a program before you get into it. When we've done this program with people, we see many changes in their life. And when I say change in their life, I'm looking at your from a medical standpoint, from your lab values, from what your body is telling us about you, or what your body is telling you about you. When it comes to your cholesterol levels, when it comes to your blood sugar levels, when it comes to your body fat, when it comes to your fatigue, when it comes to allergy symptoms, and all those type of things. We see when people do this 40-day detox program that they see a lowering of their cholesterol. Number two, they see an increase in their energy. Number three, they see better blood sugar control. So people who have tendencies toward diabetes will improve that. People who are diabetic tend to reverse those symptoms that they're seeing every day. Also, high blood pressure. High blood pressure is a big issue, and we tell people that high blood pressure is not a disease, but it's a condition of your blood pressure being elevated higher than it should be. But when you change what you put into your body, when you change how you treat your body, when you cleanse your body, when your organs are functioning much better, you see a change in your blood pressure, that you can actually reverse that condition of high blood pressure to a more normal intensive blood pressure. We see people in their everyday lives just having more energy and more vibrant. One thing you see right away within 1 to 2 weeks after you start a program is a decrease in your sugar cravings, a decrease in starch cravings. You're able to get through the day without wanting that bowl of ice cream before dinner or even after dinner. So these are the things that are so important when people want to make those lifestyle changes. Because when we eat, and nutrition is not just about the food or the taste, but it's about the health. Because your health is your wealth, and without that we don't have anything. So let me give you an overview of the program and how the program starts. Now, with our program, it is a medically supervised program. So what that means, number one, is that we do laboratory work. There's some comprehensive blood work that we usually will order before we get started, and also we will repeat that after the end of the program. That way you can see the before and the after and be able to compare your lab work and see how well you improve. You can actually see the benefits of doing this type of program. The first step is we do between a 30 to 45 minute evaluation and explanation of your lab work, along with the initial instructions about how the program works. Now, with this program, the first step is to do a 14-day colon kidney cleanse, and that requires that we use a product, herbal supplement that will actually cleanse our colon, and then we follow up the next 13 days doing a kidney cleanser and also herbal supplements that help replenish and regenerate and repair any damage you've done over a period of time to your colon, hopefully to improve the situation. And I'll talk about some of the damages and how we cause the damages to our colon in just a minute. The second part of the program is to do a 30-day parasite and heavy metal detox. Now, in traditional medicine, we don't really give parasites a lot of consideration unless we talk about children. You know, when you take children to a pediatrician, sometimes children are diagnosed with having parasites, and there are medications we give children for parasites. But we have to understand that parasites don't only occur in children. If the children have it, also the adults have it. So we have to do a job of doing some anti-parasite control in our own body. Another big factor of this 30-day part of the program is a heavy metal detoxification. And what that includes is taking metals like lead, like mercury, like aluminum, and cadmium. Those are the 4 primary metals that we get exposed to on a daily basis that will end up causing fatigue in our life. They can cause things like memory loss. They can cause a host of conditions that we end up taking allergy symptoms for or other medications trying to fix those problems, but you're actually putting a band-aid on that toxicity from metals. The third step in the program is to do what we call a liver gallbladder flush. Now, the liver gallbladder flush requires that we cleanse our liver thoroughly, and the gallbladder flush is a program designed to rid your body of gallstones. Now, of course, I want you to understand that gallstones are made in the liver, and a lot of them are captured or collected in the gallbladder. And you hear sometimes that people have problems with their gallbladder. They may even develop an infection, and it could be a serious condition. But what we want to do is we want to cleanse our gallbladder so we don't get to that point. Even if you do have gallbladder symptoms, you can cleanse your gallbladder and either reverse or even eliminate those symptoms just by doing a cleansing on your gallbladder. We've seen that with a number of our patients in our practice, and we ask people to try that for themselves if they do get to that point. But what we want to emphasize also is that cleansing your gallbladder and your liver on a regular basis makes your body function much better, and you eliminate the possibility of a lot of conditions like that arising in your life. So again, first is a 14-day colon kidney cleanse. Second is a parasite cleanse, heavy metal detox. Third is a gallbladder liver flush. Now, over this 6-week period when you do this program, what is required is a nutritional program. I call it an eating plan. It's not a diet plan because you're allowed to eat as much food as you want, but what you eat is really what's restricted. Now, the main thing is this program requires that you eat 80% raw. And when I say raw, I'm talking about raw vegetables and raw fruits. You don't have to eat raw meat on this program, but it's a raw food diet. It's not necessarily a vegan diet because we don't eat processed food. Soy and soy-based products or soy protein products are not really included in this program. You can eat 20% cooked food, and that includes things like organic brown rice. Also, beans are included, soups, things like baked sweet potatoes are allowed in the program also. And as far as animal protein, we recommend only eating tilapia and wild Alaskan salmon and maybe sardines with the first 2 weeks of the program. After the first 2 weeks, the next 4 weeks of the 6-week program, you're allowed to eat chicken, organic chicken for sure, as a part of the program. So basically, you're going to be eating a diet of vegetables and lean proteins like a fish for the first 2 weeks, followed by chicken. Now, One thing to include, there is a water requirement in the program. We recommend drinking water, spring water, at least half your weight in ounces. Now what that means, if you're a person that weighs 200 pounds, that your water requirement for our day during this program is to drink 100 ounces of water. And water is so important because it helps the flushing process while you're going through the cleansing program. And flushing is so important because as toxins are coming out of your body fat, as they're coming out of the cells of your body, you want to be able to flush them out of your body and improve the function of your kidneys and help really rid your body of those toxins. So it is important to drink water during the program. Now, at the beginning of the program and at the end of the program, there are 2 points that we call stay-at-home days. And I say that because on those days, the bathroom will be your best friend because you'll spend your day at home back and forth to the toilet many, many times because that's a part of the cleansing process. But outside of those 2 days for the 6 weeks, you go through your normal daily routine, your daily activities, and you basically won't have any problems when it comes to being able to exercise or do activities that you would normally do during the day. You know, this program is a very powerful program. It's designed to really change things in your life. I'm going to put up a slide to just show you some information to show you how people's cholesterols have improved, their blood pressure have improved, also that their hemoglobin A1C. And for those who are not familiar with that, that's a blood test that's taken to show your average blood sugar over a 3-month period. Now, most laboratories and most physicians' offices will say that if your hemoglobin A1C is 6.0 or higher, that you're considered in the diabetic range. Most of the time, doctors, when you get to being a 7 or higher, they would treat you for diabetes. And that means it may be medication, it may be insulin injections, or whatever protocol your physician might recommend. Now, with our program, what we've seen, we've had people with hemoglobin A1C who are diagnosed diabetics, and by doing the program, cleansing their body, changing their diet, they were able to get that number down from that 7 or 8 hemoglobin A1C down to under 6, 5.9, 5.8, 5.7. It just depends on you and how committed you are to the program. You know, any program you do takes a level of commitment. And that's what we ask from our patients, that you be committed to this program. We're not asking you to join the program just to try it and see how it works for you. But if you truly want to improve your health, if you truly want to prevent diabetes, if you truly want to control your blood pressure for the rest of your life, if you truly want to get rid of allergy symptoms where you're not tied to allergy medication or sprays, if you truly want to improve your energy level, if you truly want to increase your mental clarity, get rid of the forgetfulness that we have so often, this is a program that can really benefit you. I recommend you call our office to get more detailed information about it, and we'll be happy to share with you how the program works, the cost of the program, and any other additional information you may need. Again, I'm Dr. Floyd Atkins. Our office is the Center for Wellness and Healing, Houston, Texas. Give us a call. We'll be glad to help you.